So ventilator. So one ventilator is one of the assist device used in the patient. So ventilator going to use for improving the ventilation of the lung and to supply humidity or aerosol medication to the pulmonary tree continuously or intermittently. So that means ventilator is a device which helps to improve your ventilation in the lungs. Okay. So when the patient feeling difficult to breathe or have ventilation to the lung, less ventilation to the lung, then with the help of the ventilator, you will provide proper ventilation to the lungs of the patient. Okay. So I think you all know what is pulmonary tree. The in the lungs, you will be seeing the pulmonary tree, presence of pulmonary. Through that only bronchitis. Do you remember? In your biology, you will be learnt about the structure of lungs. In that, you will be having pulmonary bronchitis. So through that only, you are going to have the respiration. Okay. So, what are the modes of? You don't want to go into the structure of lungs at all. Just we are going to study only the device. Okay, not about the lungs parts, etc., etc. Just we are going to study about the device which is used in the lungs. Okay. So, modes of operation. Ventilator will be operated in three modes. That is assist mode, control mode, or both the modes. That is assist control mode. So, when a patient is incapable of adequate ventilation by natural process, inadequate means incapable of adequate means not getting the enough air or oxygen to the lungs. Okay, so at that time you will be having mechanical assistant, that is a device, ventilator device, which will be providing sufficient organ oxygen to the lungs. Okay. Mechanical assistance must be provided so that sufficient oxygen is delivered to the organ and tissues of the body and excessive levels of carbon dioxide are not permitted to accumulate. So by using this ventilator you can provide a high oxygen, that is sufficient oxygen to the organs and tissues of the body, as well as you can expel the carbon dioxide which will be having excessively in your body or accumulated in your body. Okay. And then in now we are going to see the assist mode of ventilator. So in the assist mode, inspiration is triggered by the patient. A pressure sensor respond to the slight negative pressure that occurs each time the patient attempts to inhale and trigger the apparatus to begin inflating the lungs. That means you are going to use the pressure sensor in the ventilators assist mode. So the this pressure sensor will sense the pressure. Okay, negative pressure, which is due to the improper ventilation. Okay, insufficient ventilation to the patient. So by seeing that or sensing that pressure, you will be triggering the assist mode, that is ventilator will be on. Okay, this is done by the patient whenever he is getting insufficient oxygen to the body. At that time he will trigger the device. Okay, that is ventilator device by the patient. So the respirator helps the patient inspire whenever he wants to breathe. Okay. So whenever the patient feels difficult to breathe, at that time the patient will use the ventilator device or will what to say will trigger the ventilator device. Okay. So automatically it will not be triggered whenever your patient feels difficulty in breathing. Okay, at the time the patient itself will use the ventilator device. Okay, so a sensitivity adjustment is provided to select the amount of patient effort required to trigger the machine. So there you will be having sensitivity adjustment. Here the patient will be helped. So how much amount of oxygen to provide to the patient. That will be provided in the sensitivity adjustment itself by measuring your negative pressure in the sensor. So the assist mode is used for patients who are able to control their breathing but are unable to inhale a sufficient amount of air without assistance, or for whom breathing requires too much. So by in the ventilator working in assist mode, the patients will not require a assistant for making the arrangement of ventilators to the patient. Okay, so he will do all the controlling process. Okay, the patient itself will do the controlling process because he may able to breathe. Okay, so whenever he feels difficult to breathe, at that time only he will be searching for the ventilator to use. Okay, next, control mode. So in the control mode, breathing is controlled by timer. That breathing is controlled by patient. Okay, but here the breathing is controlled by timer which going to set the desired respiration rate. Okay, there patient will be setting all these setups. Okay, the timer setup will be done by the patient in the assist mode. In the control mode, automatically your timer will set the respiration rate. Okay, so controlled ventilation is required for patients who are unable to breathe on their own. So patients who are unable to breathe on their own will be provided by the control mode ventilators. Okay, in the assist mode, when patient will have the uh, breathe on their own. Okay, whenever they are feeling difficulty, at the time only you will be placing the ventilator. Okay, that is assist mode. In control mode, continuously you will be having the ventilators in the patient, used by the patient. Okay, for breathing. So in this mode, the respirator has complete control over the patient's respiration and does not respond to any respiratory effort on the part of the patient. Okay, so completely your lungs, the patient lungs depends on the ventilator. Okay, but in assist mode, it will be depending on the lungs for respiration process. Okay, so lungs respiration process in deficiency இருக்கப்ப மட்டும்தான் it will seek the assist of ventilator. Okay, otherwise it will be it will take the breath only in the respiratory system of human body. But இங்க பார்த்தீங்கன்னா it will not depend on the respiratory system of the human body. So the breathing will be, entire breathing will be depending on the ventilators used in the patient. Okay, that is the control mode. So in the assist control mode, the apparatus is normally triggered by the patient's attempt to breathe as in the assist mode. So here also the same triggering process only will be followed as seen in your controlling method and assist method. Okay. However, if the patient fails to breathe within a predetermined time, a timer automatically triggers the device to inflate the lungs. So assist mode la எப்படி இருந்ததோ அதே setup தான் for triggering purpose. But என்னாகும், whenever the patient fail to breathe, இங்க வந்து என்னாகும், ஆட்டோமேட்டிக்காக டைமர் வந்து கால்குலேட் பண்ணிக்கும், ஆட்டோமேட்டிக்காக ட்ரிகர் பண்ணிடும். பட் தேர் இன் அசிஸ்ட் மோட், patient will be triggering the device. Okay, but here the timer will be used for triggering the device. Okay, thus the patient control his own breathing as long as he can, but if he should fail to do so, the machine is able to take over for him. அப்படின்னா என்ன, பாதி அசிஸ்ட் பாதி கண்ட்ரோல் மோட். ஸோ டில் the patient able to control the breath. Okay, at that time it will be working in assist mode. Okay, whenever the breathing control failed by the patient, at that time the control mode will be on. Okay, that means automatically your timer will be triggered the device. The device means ventilator device. Okay, so it will be waiting for a particular time period other than a predetermined period. Okay, in the timer you will be fixing time. So in that period, if your patient fail to breathe, okay, so automatically அந்த டைம் பீரியட்ல breathe பண்ணலன்னா automatically your device ventilator device will be on, that is control modeக்கு switch over ஆயிடும். Okay, so this mode is most frequently used in critical care settings. So critical care settings la it will be used in this mode. So once inspiration has been triggered, inflation of the lungs continues until one of the following condition occur. So இப்போ வந்து ventilators on பண்ணியாச்சு, inspiration process is going on. Okay, so how the lungs inflate, that is given based on the following conditions. Okay, so first condition is the delivered gas reaches a predetermined pressure in the proximal or upper airways. A ventilator that operates primarily in this manner is said to be pressure cycle. So delivering gas from the ventilator reaches a predetermined pressure. So already we will be determining the pressure, how much pressure have to be reached to the lungs. Okay, that is airways is nothing but the path of the air with oxygen going to the lungs will be called as the airways. Okay, so this will be predetermined. Okay, so that will be called as a pressure cycled based on the pressure determination your oxygen will be passed. Then a predetermined volume of gas, இது வந்து pressure, how much pressure, first point வந்து how much pressure, amount of pressure, based on that it will be gas will be moved to the lungs. Second point பார்த்தீங்கன்னா volume of gas, so எவ்வளோ volume send பண்றோம். Okay, volume of oxygen sent to the patient. So இந்த mode வந்து என்னன்னு சொல்லுவாங்க, volume cycled ventilator. Okay, based on volumeங்கிறதுனால volume cycle ventilator. அது first point வந்து based on pressure. Okay, அதனால அது பேரு pressure cycle, இது வந்து volume cycle ventilator. Then third point based on the time. Okay, period of time we are sending the air or oxygen to the lungs is achieved or used in this mode. Okay, that is time cycled ventilator. Third point. So 3 point based on pressure, based on volume, based on time. Okay, the மூணு பொறுத்து தான் you are going to provide the gas or oxygen to the lungs. Then types of ventilator. So two types of ventilator given here. Pressure cycle positive pressure assisted control, volume cycled ventilator, that is volume respirator. So this is pressure cycle positive pressure assisted controller. This is a device. So based on the pressure needed in the lungs, it will be providing the oxygen to the lungs. So the device is powered pneumatically from a source of gas and requires no electrical power. So here this device will be operated based on the oxygen gas. Okay, so here no electrical power is required. Devices in this category may contain an electrically powered compressor or can be used with a separate compressor to permit ventilation with ambient air. So here this device can be used in the category of having compressor with the electrical power. That means compressor alone will be working in under the power control, electrical power control. Okay, which will, the compressor is nothing but which will provide the ventilation to the lungs. It includes all the necessary equipment to control the flow of gas, mix air, oxygen, and sense the patient effort to inspire, terminate the inspiration when the desired pressure is reached, permit adjustment of the sensitivity of the triggering mechanism and the desired pressure level, and even generate a negative pressure to assist expiration on some device. So these are all done by that single device. Okay, which will be controlling the oxygen flow, and also mixing the air with the oxygen, that also control. And also it will be sensing the inspiration of patient. Okay, how much patient inspiring the oxygen, that will be sensed. Based on that, it will provide the gas to the lungs, and also it will be able to terminate the inspiration. Okay, whenever the desired pressure is reached in the lungs, it will be terminating the inspiration process, and also provide the adjustment while you are triggering the device. And then it will be managing all the pressure level, as well as it will assist for expression process also. Okay, inspiration மட்டும் இல்லாம expression also done by the same device to some other device. Okay, here we are going to use special type of valve that incorporates a magnet senses the small negative pressure created by a patient when he attempts to inhale. ஸோ இது வந்து ப்ரெஷர் கண்ட்ரோல்டு டிவைஸ்னு சொல்லியாச்சு. அப்போ என்ன பண்ணோம், அங்கே பேஷண்ட் வந்து ஹவு மச் amount of oxygen inhaling, that is sensed through the pressure developed at the airways or air path of your lungs. Okay, so based on that only you will be providing the oxygen level. Okay, so the pressure which is created in the airways of lungs, so that will be determining the amount of pressure given to the patient. Okay, so timing for operation in the controlled mode is accomplished by filling a chamber with gas and letting it bleed off through an adjustable needle valve. So here the timer circuit will not be will be used for controlling process. And then the gas chamber is nothing but the chamber, air filling chamber in the lungs, which will be filled by oxygen or gas. Okay, so that will make to bleed off through an your adjustable needle valve. Okay, so in the prescribed time, the pressure drops to a level at which a spring loaded valve can operate. Here you will be using the defined time. Okay, so which will determining time will be set at previously to drop your um, oxygen, okay, through the valve, that is spring loaded valve. Okay, spring loaded type of valve going to be used for say, in the air path or airways of your lung tract. Okay, so this type of device is shown in figure, uses either a piston or below to dispense a precisely controlled volume for breath. This is volume cycled ventilator. See, picture of volume cycled ventilator is given here. So this type of ventilator will take the inspiration or will get the gas or oxygen to the lungs based on the volume. Okay, so based on the volume means how much amount of volume have to be intaken to the lungs. Okay, uh, here you will be using either piston or bellows to dispense a precisely controlled volume for each breath. So ஒவ்வொரு breath அப்பவும் எவ்வளோ amount of gas have to be taken inside, that will be considered by the piston or bellows. Okay, so in the critical care setting where patients have pulmonary abnormalities and require predictable volume and concentration of gas, this type of ventilator is preferred. So in critical cases, this type of ventilator will be used. Okay, critical cases means when the patient feels very difficult to breathe. Okay, at that time, this type of ventilator will be required. Okay, selected. It is much larger than the pneumatically operated. So pneumatically operated, this is not pneumatically operated. So units and most units stand on the floor beside the patient's bed. So mostly this setup will be on the back side of your patient bed only, because this not going to be used in pneumatically operation. Actually, pneumatically operation means with the help of pressure it will be operated, but this is not operated based on pressure. Volume respirators are electrically operated. So this is completely electrically operated. That no electricity is required other than your compressor. Okay. But here the full device will be operated on electrical signal. Okay. And provide a much greater degree of control over the ventilation than the pressure cycle types. So in the pressure cycle type, there is no need of any more control. Okay, but here we it will be based on the higher control. Okay, for the ventilation purpose. So most devices of this type have adjustable pressure unit and alarm for safety. So இதில் வந்து they will be having the adjustable pressure unit as well as alarm. Okay. So alarm for safety purpose. Okay. So whenever the patient feels in difficulty, okay, that time the alarm will ring. So adjustable pressure unit will help to adjust your pressure value of your oxygen. And then volume cycled ventilators used in critical patient care are always supplied with a spirometer to permit accurate monitoring of the patient's ventilation. So in the volume cycle ventilator we are going to use spirometer to monitor the device. Okay, spirometer will monitor the ventilator device, patient's ventilator device. So a form of volume controlled respiration is possible with the type of pneumatically operated respirator that permits time cycling. This flexibility is based on the premise that a given amount of airflow for a specified time duration result in a controlled volume. So we can use the same ventilator in the pneumatically operated manner. So this can be operated pneumatically based on fixing the time. Okay, the time duration will be specified in the controller. Okay, so based on that you can use the device in the pneumatically operator. Okay, so you can operate in the pneumatically manner. Okay, so other available features include a heated humidifier. So other features available in the ventilators are heated humidifier and optional capabilities for negative pressure and positive end expiratory pressure. So three other features are present here. One is humidifier. So this device, the same device, ventilator device will be used as a humidifier. Okay, அதே மாதிரி it can be used to for getting the negative pressure also, or measuring the negative pressure created in the lungs also. Okay, and then it will be used for exhaling purpose, that is uh, expiratory pressure. Okay, which is developed in the lungs will be expelled out through this device. Okay, that is PEP, that is positive and expiratory pressure. So these three features will be the additional features of your device.